If this is hard to do, wear a mask at all times. Distancing is a must even at the beach. Try to keep a 2-meter distance between parasols. When using public facilities, wear a mask and avoid physical contact with others. With another scorching summer upon us, stay safe from the heat and COVID-19 by following the safety tips.
Welcome to Arirang Live. It's after 2 p.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. Earlier in the morning, we learned that South Korea has confirmed 49 new COVID-19 cases on Saturday. 44 of them are local transmissions, all from the Seoul metropolitan area. Those cases are from cluster infections that have spread from a door-to-door sales business. Also, there are growing concerns over people who initially tested negative for the virus, later being confirmed to have it. Health authorities have urged people to remain in self-quarantine even after testing negative. The nation's total COVID-19 caseload now stands at 12,051. The briefing has just begun, so let's take a listen.
Today we have 49 new cases and the total number of confirmed cases now stands at 12,051. This includes 1,330 imported cases from overseas. Today, 22 more people have been fully recovered and a total of 1,083 people are in quarantine undergoing treatment. We have no additional fatality. And today we have 5 imported cases, 4 were from Europe and others, 1 from other UAE in Asia. Also, we have some updates on the domestic infections here at the newly planted churches in the Seoul metropolitan region. We have 5 additional cases confirmed and a total of 100 cases have been confirmed to date. And in Ridgeway in Gwanak-gu district, Seoul City, we have 14 additional cases compared to yesterday. In total, we have 153 cases confirmed to date. And at a sports facility in Yangcheon-gu district, Seoul, we also have 1 additional case who was a contact under self-quarantine, and a total of 62 people have been confirmed to date. And in Dobong-gu district of Seoul, we have the Seongsim Daycare Center. On June 12th, we have the first ever confirmed patients, and also we have 11 new workers of who have been confirmed, and also confirmed additional patients of the contacts, including the family members, and a total of 16 confirmed cases have been confirmed to date. And the KCDC, as we are entering the weekend, we would like to highlight that a lot of the latest cluster infections have spread at ground basement floors, as well as gatherings that did not have good abidement to the quarantine measures, including distancing and wearing of face masks. So during the weekend, as for the worshipping places and other religious facilities, we advise you to cancel or postpone small group meetings that involve conversations, singing, or eating together, or switch them to non-face-to-face methods. If on-site worship service is held, these facilities need to reduce the number of participants to ensure that participants keep a proper distance from each other, check people for their fever and other symptoms, and ensure hand washing and mask wearing. And you should also make sure that no meals are provided, and they do not engage in activities that release respiratory droplets in the air, like singing, chanting, and shouting. We are seeing the rise in the number of elderly cases, and the number of patients with severe symptoms is also on the rise. So we ask for the elderly citizens to take precautions. People who are aged over the age of 65, you are advised not to visit enclosed spaces without windows or that are poorly ventilated. If such an occasion is unavoidable, activities such as eating and singing should be refrained. Masks should be worn at all times, and you need to wash your hands or sanitize your hands on a frequent basis. And as for the people with chronic medical conditions, we need you to have a continuous taking care of the chronic medical conditions and your health conditions, and you need to also visit a clinic when necessary and wear a face mask if you visit these facilities. And we also have very hot weather, and the temperature is very hot, and there are many medical staff who are working under the scorching heat. And in the summertime, we will aim to decrease the fatigue and the burden of the medical staff members, and we will also provide more support to the medical staff. And we also have further messages to the public. At the center of the quarantine measures against COVID-19, one of the most crucial task is to decrease the rate of fatality. Therefore, as for the citizens over the age of 65, we ask you to refrain from social gatherings or other meetings. And if you have chronic illnesses, please avoid crowded, confined, and close contact environment. These messages have been stressed for multiple times during the past. And as for the senior citizens living in the metropolitan area, we advise you to stay home. And however, we need to also have the cooperation of other age levels as well. And after May, we also saw an increase of the cluster infections centering around young people, especially those in 20s and 30s. However, they have also outreached to other cluster infections, including a logistics center and nursing hospitals as well. And this makes the senior citizens to be open to more risks of fatality. And we believe that if the prolonged outbreak continues, many people are feeling fatigue over the distancing. And centering around young people, many just conceive that COVID-19 is just a simple type of disease or sickness. However, we need to remember that we need to also protect people aged over the age of 65, and also we need to protect people with chronic medical conditions, and therefore we need to ask all of the members of the public to keep with the social distancing measures as well as personal hygiene measures. And under the scorching heat, on average, about 10 to 20,000 people are getting tested a day. And we also advise the medical practitioners to wear, instead of the level D protective gowns, to wear the 4 types of surgical gowns that were also advised by the WHO. And we would like to take this opportunity to thank all of our medical staff members once again, and please let us protect each other once again for the sake of the safety of the community, and please let us continue to exert our efforts going forward. Thank you very much.
There you have it. We'll bring you more details on the briefing at our upcoming 6 p.m. regular newscast. Until then, goodbye.
Pneumonia-like virus